Our presentation today will be about white blood cells. And so basically all blood cells are formed in the bone marrow, the soft material in the center of most bones. And as you can see, there are three types of blood cells. White blood cell, which fights off infections, the red blood cell, which carry oxygen, and the platelets, which control clotting and bleeding.
So, this is what a blood vessel looks like. The red donut-shaped things are the red blood cells. The purplish spherical things are the white blood cells. The yellow liquid is the plasma, and the spiky brown stuff are the platelets.
So as you can see here in the diagram, the blood stem cell forms many different types of blood cells. Now, the two major types of stem cells formed from the blood stem cell are the myeloid stem cell and the lymphoid stem cell, which later branch off to form many different types of blood cells. If a blood cell matures into a lymphoid stem cell, it later becomes a lymphoblast, which later becomes either a B lymphocyte, T lymphocyte, or a natural killer cell. All three of these are white blood cells. However, on the other hand, if a blood stem cell matures into a myeloid stem cell, it can then become either a red blood cell, a platelet, or a myeloblast. If a myeloid stem cell becomes a myeloblast, it later becomes a granulocyte, which is a category of white blood cells. The granulocytes consist of eosinophils, neutrophils, and basophils.
In summary, here are the main types of blood cells. They consist of white blood cells, which include monocytes, lymphocytes, neutrophils, eosinophils, basophils, and macrophages, which are a type of monocytes, and erythrocytes, which are red blood cells, and of course, platelets. Neutrophils are the most common types of white blood cells. They make up 50 to 70% of all white blood cells. The average lifespan of a non-active human neutrophil is 5.4 days. If they're activated and located in the tissue, they survive for one more day. They are subdivided into segmented neutrophils, or SEGs, and banded neutrophils, or bands. They are one of the body's main defenses against bacteria. Neutrophils can devour 5 to 20 bacteria in their lifetime. Lymphocytes are usually 7 to 8 micrometers in length. There are two general types of lymphocytes: large cells and small cells. Large ones are called natural killer cells, and small ones are separated into two categories, T cells and B cells. Lymphocytes make up 20 to 40% of white blood cells. Monocytes are part of the innate immune system, which is the first line of defense and is generic and recognizes pathogens of vertebrates. They replenish macrophages under normal states and move quickly to sites of infection and split into macrophages to elicit immune response. Precursors in macrophages, which migrate into tissues after a certain amount of time to become macrophages, are phagocytic tissue cells of the immune system that may be fixed or freely motile and functions in the destruction of foreign antigens, such as bacteria and viruses. They also stimulate lymphocytes to respond to pathogens, and they come from monocytes. Eosinophils are a type of leukocyte. 2 to 4% of all white blood cells are eosinophils, with a count of 350 to 650 of them per cubic milliliter. They're named eosinophils because their cytoplasmic granules stain red with the dye eosin and are acid-loving. Eosinophils are responsible for combating multicellular parasites and certain infections in vertebrates. It is also responsible for mediating allergic responses along with basophils. Basophils make up 0.5 to 1% of all white blood cells and are the least common types of granulocytes. They appear in many types of inflammatory reactions, as well as in high numbers in ectoparasitic infection sites. They have granules that stain with basic dyes.
This is a normal white blood cell. This is a mutated white blood cell. The mutated white blood cells is the cause of the disease leukemia. And leukemia blood cells don't die when they should, which makes them crowd out other blood cells, which disables the other white blood cells from working properly. There are two types of leukemia: chronic and acute. Chronic leukemia is when your condition gets worse slowly, and the leukemia blood cells at first are able to function normally, but later on the symptoms start to show and your condition gets worse. And an acute leukemia is when your condition gets worse quickly and the leukemia cells are unable to work properly. Leukemia is also categorized by what type of blood cell it infects. There is the infection of the lymphoid blood cells and the infection of the myeloid blood cells. The infection of the lymphoid blood cells are often called lymphoid, lymphocytic, or lymphoblastic leukemia, while the infection of myeloid blood cells are often called myeloid, myelogenous, or myeloblastic leukemia. Chronic lymphoid leukemia accounts for 50,000 cases each year and normally affects people over the age of 55. This kind of leukemia never affects children. On the other hand, chronic myeloid leukemia accounts for 5,000 cases each year, and it mainly affects adults. Acute lymphoblastic leukemia also accounts for 5,000 cases each year, and it most commonly affects children. It also affects adults as well. And acute myeloid leukemia accounts for 13,000 cases each year and occurs in both adults and children. Symptoms of leukemia include swollen lymph nodes that usually don't hurt, fevers or night sweats, frequent infections, feeling weak or tired, bleeding and bruising easily, weight loss for unknown reasons, and pain in the bones or joints. This picture illustrates the number of eosinophils people normally have. This picture, on the other hand, illustrates eosinophilia. This occurs when an abnormally high amount of eosinophils are contained in a person's body. Eosinophilia can be caused by asthma, hay fever, or parasitic infection. This occurs because our body increases the number of eosinophils in order to fight off parasitic infections or allergic diseases. This is useful for parasitic infections, however, it is not so useful for allergic diseases, as they just accumulate in the tissues. And if eosinophilia is caused by asthma, symptoms such as wheezing and breathlessness are present, while if the eosinophilia is caused by parasitic infections, abdominal pain, diarrhea, fever, coughing, and rashes occur. There is a special type of eosinophilia called hypereosinophilic syndrome, which is eosinophilia caused by no apparent reason. This can often lead to heart failure, breathlessness, ankle swelling, enlargement of the liver or spleen, swelling of the abdomen, or skin rashes. In the picture on the right-hand side, it illustrates the amount of white blood cells a normal person should have, while on the other side, it illustrates a decreased amount of white blood cells in a person. This disease is often called granulocytosis.